Hey, it's Jack Maxwell. Welcome to the High Road live Q&A before the actual episode of the High Road, where it's week number 10. And the episode is, it's so fun for me because, and I don't know her first name. I don't think I ever got it, but Mama Milburn, a nice, sweet, elderly, charming woman from Kentucky, decided she was going to try to stay off of opiates for her broken arms. But she didn't know what to do. And her son, Drew, just happened to be in the cannabis business. And he said with some trepidation, he approached her. He's a little nervous, a little sweating perhaps, because, like most good boys, they're still afraid of their mother. And but he wanted to suggest something that he knew worked really well for him and for others. And so he suggested CBD, I believe. You'll see the interview right after the show. But it's fascinating because she, as I say, ticks off all the boxes of someone who might not be, let's say, I guess, predestined, not have a proclivity to using cannabis. She's elderly. She's religious person. She's a preacher. She's a nurse. She's a mother and grandmother, as I say later. So, it's really interesting because she was really open-minded about it. And I think if someone like that can be open-minded, so can we all. And again, it's not about whether you use cannabis or consume cannabis or not, or CBD or medicinal cannabis, however you want to frame that or call it. It's just about being open-minded to the possibilities. Because as you probably know from now, I know you know somebody in your family, in your circle of friends, in your social community that's probably using CBD and THC to whatever extent, at least medicinally. So this is why I am conducting an experiment tonight, due to the fact that Mama Milburn used this concoction in whatever way she did and got relief. And I shared with you, of course, before how I used both CBD and medicinal cannabis in tincture form for my neuropathy from chemo. But also, as you know, I'm not a recreational user necessarily of cannabis. But today at 4:20, how symbolic, I took some medicinal THC in a gummy. And for those who have seen the show before, if I didn't tell you, and I know that's a big caveat, can you tell the difference? Because I don't feel it. I don't know necessarily if I would know how I'm coming across. And that is, of course, 4:20 my time. So it's about an hour and 13 minutes ago. And but in any event, so many people are afraid of cannabis. THC is going to do things to me. It's going to get me hooked. It's going to cause psychosis. It's a bad drug. And all of those things I know are generational. We learned that a long time ago. Back in the 30s, as I've said so many times, 1937, when it was prohibited, they scared us into believing things about cannabis that weren't necessarily true. And again, I was not a user growing up. I'm still not, but for medicinal purposes, for my neuropathy and to help me sleep, and for other people who they use it for their anxiety and everything else, they've found relief. So why aren't we allowing people to use this? Now, of course, we are, as I've said again, and I'll say many times until the numbers change, 33 states permit it medicinally. And when you think just 10, 15, 20 years ago, you'd never think that'd be the case. But people are becoming more open-minded to it. They're becoming more, of course, open to the economic possibilities as well, bringing in money for municipalities, et cetera, through taxes. So 33 out of 50 states, pretty good, and 11 recreationally. And of course, those numbers are just going to keep getting bigger, I believe. But anyway, your thoughts, your comments on all of it, because since it's kind of a medical episode with Mama Milburn and her son Drew, and he'll be the one I'll be interviewing right after the episode, which starts at the top of the hour. And you'll have to click right here on this this little thumbnail that Yusuf, my producer, will put up. Click on that at the top of the hour. This won't roll into it. We don't have that capability on this platform. But if you click on that right at the top of the hour, you'll get both the episode and the interview. So again, because it's a medicinal, medical journey, this particular one, this nice, sweet old lady who, an elderly, kind lady, not old, forgive me, Mama Milburn, because she got relief, she is now an advocate for it, which is an important thing. You know, when you love someone, you care about them, you say, hey, I tried this. I didn't know it would work, but it did. Here, try it. So I know many of you are in the same boat, in the same position, and you have many questions. And you've asked a lot of medical questions over the last 9 weeks before tonight, and I can't answer them because I don't feel I'm qualified. That being said, we have a doctor with us tonight who's going to answer your questions. I asked you yesterday through social media if you had questions. So we're going to put those up. We're going to take your live questions and any comments you have, because I know a lot of us are in pain right now, emotionally, physically. It's a tough time, and maybe others are looking for, I guess, something so they don't feel the pain. And again, I mean, whatever you're going through surgically, medically, issues are exacerbated by the emotional tension we're all feeling. What's going on with our country right now. So none of us want that. We all hope it will get better very soon. But at the same time, if you're going through something and you're on either opiates or maybe you're turning to the bottle, whatever you're doing, just keep cannabis in mind. Don't be afraid of what it is, but always, as we do, as we say, speak to a medical professional, which we have with us right now. And we're lucky to have her. Here she is, Dr. Monica Torres. Hi, Doc.
Hi, how are you?
I'm doing great. I know you had us, we had you on the first week and we interviewed you, but now so many people are asking questions and we really want to get to them. So I'm going to stop rambling and get to these questions, and you just answer them the best way you can. And as short as you need. And I'll just shut up for the first time, and then we'll go through them as quickly as we can so we get a lot in. Is that okay with you?
That's fine by me.
Now, just to give you a little background on Dr. Torres, she is a pain specialist. And I went to see her a while back, a couple of years ago, for pain that I was having, like I told you, from chemo, neuropathy, etc. And she was one of the ones who was open-minded enough in the medical community to at least have a conversation about it. Never pushed me towards it, never even steered me to it. But if you saw the first episode of The High Road, you know, she's open-minded to it, as a lot in her community are starting to become now. It used to be quite demonized. And now I think opiates are taking that place because people are dying, overdosing from opiates, getting addicted. They have been for a long time. And again, opiates have their place, but in my estimation, not for long-term, not for chronic issues. And I think Dr. Torres will have her own thoughts on that. So let's get to the first question. Yusuf, if you could pull that up. This is from Booze Bucket. Doc, what strain is best for general anxiety disorder? Is that even a thing, general anxiety disorder? I just thought it was called anxiety. I didn't know it was an official name. All right. Which is more effective, flower or carts at the same THC level? And carts, I guess they mean vapes. I'm not sure, but take it away.
Okay, so I don't have much evidence or studies to support specific strain. However, I do know with generalized anxiety disorder, several patients have reported benefit. There aren't much studies that support CBD or cannabis use for anxiety, but anecdotally, we do have support for generalized anxiety disorder. I'd like to state that with generalized anxiety disorder, it's not just one thing that will be helpful, but it involves your environment. We're talking about your diet. We're talking about relationships. If you're in an abusive relationship and that causes you anxiety, if you're taking CBD or cannabis, it's not going to go away. When it comes to medical conditions, like if a patient were to show up in my clinic and they have symptoms related to anxiety or pain or both because they happen to commingle with each other, I look at a holistic approach. It's not just one medication or one thing that's going to make everything better. I believe in a holistic approach, which includes spirituality, mind-body connection. So I incorporate meditation, mindfulness, breathing techniques. I'm not the first to jump into pharmacological agents like SSRIs or any medications like that. But CBD, for a vast majority of patients that have anxiety, have benefited from that. And in this case, I would say with anything, always talk to your doctor first and always start low and go from there. Everyone that I've talked to, because I'm writing a book right now on cannabis, and I'm interviewing patients of mine as well as my followers on Instagram regarding their use and what's been helpful and not helpful for them. And it's a self-discovery. They noticed they started at the lowest dose, and then they took that for a few days, increased it gradually. And thankfully now that their anxiety is well controlled. But again, it's not just CBD, but it's nutrition, it's meditation, it's involves your environment, the people that you interact with. You want to be around positive people, and that's also going to affect your mood, such as anxiety.
Imagine that, a doctor who says it's a holistic approach, not just, oh, it hurts, take a pill. Because when I was growing up, my grandmother on my father's side, whenever I'd go visit, it would be her back, her knee, her neck, whatever, nausea. And I went to the doctor, he gave me a pill. And I think it was like that for the longest time. And there was a great divide between the medical community and the so-called naturopaths or holistic community. It's really nice to see that coming together, because I think it's for the betterment of all of us. Let's get to question number 2, or the next question. Yusuf, Deputy Dave, 41. If I rubbed a CBD type cream on the bottoms of my feet for neuropathy, would THC show up in my bloodstream? Good question.
The answer is maybe.
You're supposed to be an expert. What kind of answer is that?
Well, I'm going to explain. So the FDA actually did a survey of all the CBD products. They studied all of the products. They sent it to a laboratory for testing, and they found out that the milligrams and the dosage and what was stated on the label was not what was actually in the product. So you're going to get some CBD products that technically are supposed to have less than 0.3% THC, but may have a little bit more. So in that case, and I can speak from experience because I work in a pain clinic. I have patients that are using CBD cream for their joint pain, and I'm also prescribing them opiate therapy. And part of the treatment program is I do random urine testing for compliance, and the urine drug test would come up positive for small trace amounts of THC. And I'd have a discussion with the patient, and they would say, oh, yes, I'm using a CBD cream. And so I document it. I don't necessarily tell them to stop that, because if it's helpful and it's actually helping them reduce their opiate intake, then I'm all for it. So as long as there's just really trace amounts, I'm okay. But that's not to say your pain physician would be okay with that either, or your employer.
Speaking of feet and THC, I had a guest on a couple of weeks ago who said he's obviously a big advocate for recreational use. He said he would get high and then go running. Would you recommend that?
Well, interesting fact that running actually increases cannabidiol release in your body. So not only does running help with endorphin release, and it's a feel-good hormone, but it also activates your endocannabinoid system. So that's actually pretty cool. I just wanted a little fact.
Yeah, I don't know. I think I might try that, but I think I'd have a problem with my joints. Okay, next question. What is that? Freedom.Stasika. With so many brands out there, how do you determine the best one to use? Oh, I've handled this question a bunch. I use CBD cream for wrist and knee, but still looking for the right oil to take for sleep and stress, and sometimes migraines. That's a tough one, Doc, because I know that as a doctor, you don't advocate for any particular thing. You said you're writing a book, but you're not associated, as far as I know, with any products or anything like that. So take your best crack at that.
Yeah, so I don't endorse any particular product, but I always educate and empower my patients to research the company that they're interested in using their product. So go online, find out how they're extracting the CBD. If it's coming from hemp, it's going to be very difficult to extract the amount of CBD that's supposed to be beneficial. And sometimes they use solvents that can lead to toxic byproducts, which you don't want to ingest, anything that's toxic. So the best that I have read and researched is CO2 extraction. And this is going to be outdated by next week because there's always new techniques to extract CBD from the cannabis plant that's going to be safe. But for now, CO2 extraction is my favorite. Also, you want to see if they have any independent laboratory testing for each product that they send out. So each product should have a batch number. You want to look online, look at the company's website, enter the batch number, and the laboratory testing for that product should be available, including how much CBD is included, any pesticides, any bacteria or fungus or anything, because that can actually show up in these products because it's not regulated. So you always want to make sure that it's a trusted source. Make sure you know where it's grown. Make sure it's organic. Make sure there's not pesticides. The best way I know is greenhouse, because you can control all the external environment, right? It's grown in a controlled environment. You don't have to use pesticides, and it's not contingent on the climate. So I would say do your research, make sure you look up the laboratory testing, and make sure that they don't have any toxic byproducts in their product.
You know, I think that's the future. One of the things we're heading towards in cannabis is not just regulation per se, but consistency in product. Because I know still there are companies out there, and some of them get their product from China, etc. It's not well supervised. The difference in milligrams for both THC and CBD is all over the place. So it's going to be great when we get to a place where you find a product that you can really trust, a company that you can turn to and you don't have to worry about it. You say, I know what I'm going to get from them, and this works best, not only from your experience, but from what people say. And that's how brands evolve, because reliability and word of mouth, I suppose. I think we got some live questions coming in as well. Yusuf, you want to say something? Go ahead.
Yes. There are products available that the government is approving. So like Epidiolex is an FDA approved CBD product that's currently used and prescribed by neurologists for a rare form of pediatric seizures. It's not available for any condition, so you have to meet the criteria. But as we've seen with a lot of medications on the market, after several years, maybe 5-10 years, there's off-label use, meaning we can use that same CBD product that was only marketed for rare pediatric seizure disorder for other medical conditions. It's coming, it's just not going to be right away.
It doesn't make sense to me, though, that if we can use a product and an FDA-approved thing for one specific thing, it's the CBD that's effective. So why not open it up for other things and other? It just seems like a lot of red tape. I know we want it to be safe, etc., but at the same time, it seems like there's a lot of politics involved, unfortunately. All right, let's get another question for you, Doc. Jeff has it. If you want to start CBD for joint pain, where do you begin for information? Good question.
Well, that is a very good question. The American Association of Arthritis actually put out information and education for patients, because what they were finding is that a lot of patients in their clinic were using CBD already and without their knowledge. And this was just a random survey that was given to all their patients who have arthritis. And that's why I'm speaking to you today. I want to learn more about it. I'm doing more research now. Doctors are educating themselves now on what to do for arthritis, for joint pain, and how to use CBD in their practice. So the question was, how do you use CBD for joint pain? Well, I would recommend.
How do you look up information on it?
Well, that's a good question. There isn't any specific website that I have found that's reliable and credible source. I look at studies. So I look at JAMA, I look at the Cochrane report, the National Academy of Engineering and Science. They put out a study in 2017 that showed moderate evidence for treatment of pain for patients using CBD. So it all starts with just a search for studies. I would look for randomized controlled trials, because those are the ones that are most reliable. There's also the Cochrane report of 2019 that actually showed evidence for pain using CBD and cannabis.
All right, so that's all nice. Medical studies,
Look
etc.
up the Cochrane report.
Listen, I'm not saying forget all that. It's really important. You sound very professional. You sound very much like a doctor, which is really nice because we haven't had that luxury. But there's so many people that I know you've seen, I'm sure, that give you anecdotal evidence that say, I can't believe it. I tried this. No one told me medically to do so. I got it from a friend, etc., and it helped, which, goes against the Pygmalion effect. They didn't necessarily think it was going to work, and it still did, against the placebo effect. I find that fascinating.
Of course. I have patients in my clinic almost every day asking me about CBD, and they bring the conversation to me. And of course, that's why I did more research on it. That's why I'm writing a book to educate and inform and empower patients. I'm sorry, did you say something I thought I heard?
No, I was just going to say, you're writing a book. What's the name of it?
Well, that's a good question. Right now, the working title is CBD Stories.
And it's Dr. Monica Torres, and they'll be able to find you. I know we have an Instagram account for you. Let's promote that right now. So is it okay people look you up here and ask you questions, Doc?
Of course. Absolutely. And if you have any interesting experience with CBD, any positive or negative, please contact me. I'd love to interview you for my book.
We're going to put people in the book. Oh, you're going to get a lot of people. I'm sure of that. A lot of people are going to be writing to you. Don't get mad at me if your IG blows up. Let's have more questions from the preloaded questions we had before that people got online for. Yusuf, let's have one of those. I don't know how to pronounce that, but curious of what she, the doctor, would recommend for spasms and spasticity of muscles for ALS, otherwise known as Lou Gehrig's disease. Anything to help calm the spasms and cramps would be wonderful. Wow, that's a loaded question. I guess you want to take that on?
Yes. First of all, I'm so sorry that you're battling a disease like that. It takes a lot of courage. And as far as spasticity, there is actually a medication that's not FDA approved here in the United States yet, but in 30 countries, and it's called nabiximols. And it is treatment. It's a CBD THC derived from cannabis that it's an oral solution, and it's used for spasticity, but in MS, because the studies were performed on patients with multiple sclerosis. There was also, I read a study that when it comes to spasticity, it is good to have THC along with CBD. And a 1-to-1 ratio would be okay to start with, but sometimes you may need a higher THC to CBD ratio, because the THC really does calm muscle spasms and spasticity as far as the studies that I've read.
Thank you for that. What a horrible, horrible disease to have, ALS. Another question, Yusuf. Is it possible and safe? Oh, from Nathaniel Lawrence, longtime watcher of our shows. Thank you for your support, Nathaniel. Is it possible and safe to replace daily antidepressants with CBD to help with anxiety and depression? I think I know the answer to this one, Doc, but I'll let you have it.
Well, I wouldn't make any changes without talking to your psychiatrist first. It's not, if you're stable on your medication, there's no need to change. I'm talking to the person who's not doing well with current medication, and this is a discussion that you'd have to have with your psychiatrist, of course. I have read in cases where patients with depression and anxiety who use high levels of THC can actually cause psychosis. It can actually make your condition worse. And I would hate for that to happen to you. When it comes to CBD only products, that is something that you could talk to your psychiatrist about first before starting. That way it's a monitored situation. And when it comes to mental health, any changes, you want to make sure that it's under the supervision of a physician.
Great point, Doc. Thank you. We have another question, and then we'll go to some live ones, Yusuf. Heather Dolson Bunting, is CBD or THC better for bone pain or a combination of both?
Well, that's a good question. When you state bone pain, is it related to cancer? Are you talking about a fracture? Are you talking about arthritis, right? Bone pain can mean several things. And if Heather, if you want to private message me on Instagram at Monica Torres MD, I'd love to help answer that question for you. And I'll answer now, of course. If it's arthritic pain, I believe that CBD is something that you can try first. I always recommend CBD over CBD THC combination because you may not need that THC. And why would you want to take THC if there's some psychoactive side effects there? Yes, I look forward to hearing from you, Heather.
You know, it's still odd to me that a doctor like yourself, a pain specialist, and you have other specialties as well, is so informed on CBD and THC. How did you start this journey exactly? Because I don't know too many doctors who are as informed as you are knowledgeable about it. Although I'm sure there are many now, but it still feels antithetical to how it once was. When did it turn, and when did it turn for you?
Well, it's actually started 2 years ago when I had a patient come into my office, and she was going to establish care with me, and she was actually treated by another colleague of mine. So I was meeting her for the first time, and I read her chart, and I knew she was coming in for a refill of medication, and she was previously on high-dose opiates. And she had come in and said, I'm no longer taking any of those medications, and I get emotional when I talk about it because it's part of what I do, and I only want to help people. And I've seen patients not do well with opiate therapy. And so she did. She had a wonderful experience. She was only taking THC and CBD for pain, and she was no longer taking 5 medications that we had her on: a muscle relaxer, anti-inflammatory, 2 opiates. It was incredible. And she's actually going to be featured in my book. She's the inspiration for my book, one of the many inspirations for my book. But I feel that opiate therapy has a place, and it's helped a lot of my patients with chronic debilitating pain. But when it comes to arthritic pain, back pain, which can be debilitating, I think that there are other alternatives. It's not the first option that I turn to. There's so many other things that we can use to treat pain that's less addicting and less harmful. CBD is not addicting. You can't overdose. With cannabis, THC at high doses, yes, you can't overdose, but there can be psychosis. There can be liver issues. There can be drug-drug interactions. There's a syndrome called cannabis hyperemesis syndrome, which people don't really talk about. But at high doses of cannabis, people start vomiting and they can't stop until they stop taking cannabis. So there's so much to talk about. I have so much to share with your audience. And if anybody wants more information, please, private message me. I'm using my profile to help educate and empower people and inform them, because there's so much misinformation out there. And it's nice that, I'm passionate about this because I feel that this is an alternative to from other medications, including opiates.
That was a quick half an hour. Thank you for your time. I'm sorry we didn't get to more questions, but you are very thorough in your answers. And not a lot of people talk about the medical community and how they can help people with cannabis. And they're clearly, like Dr. Torres, very much informed. Before I forget, a big happy birthday to Bill Koopman. Today's his birthday. Hey, Coop, and hi, Sabrina. And also thank you to Dr. Torres. Once more, here's her Instagram account. If you want to either ask her questions or be part of her book, not that you'll guarantee to be, but if you contact her, you two can work that out. Thank you, Doc. That was very informative. Will you come on again sometime? I would love to. Yes. Fantastic. Well, thanks for being there. And here is episode 10. And again, you have to click right here onto this this thumbnail. Click there and you'll get episode 10 of The High Road, followed by an interview. Thanks for joining me. We'll see you next time.